Hi everybody, it's Dr. Magnifico from Jared'sVetPobly.com. This is Buddy. He is a 3-year domestic short-hair, neutered, indoor-outdoor cat. He, a couple of days ago, was found by his owner dragging his back legs. She brought him to the emergency clinic where they diagnosed him with a luxation. So he's got a broken pelvis. Your pelvis is essentially a box, and where the pelvis attaches to the spine has been luxated or dislocated. To correct that surgically, it means putting a pin in around here. That's about $2,500 to $3,500, which is cost prohibitive for her. So based on his initial physical exam, which is he still has deep pain in his feet. So when we pinch his back toe, he can feel it. So he's got movement in both of those. He does not like it, so he can feel it. And he also has anal tone. So when we look at his rectum, you're all right, buddy, you're all right, you're all right. His rectum will move. So he is urinating and defecating voluntarily, and he has nerve function in those legs. So all of those things really have to be present. His only option right now is cage rest. So he is going to stay in a big crate with nothing that he can get on for the next 8 to 10 weeks. And most cats will heal. Unfortunately, it's not the best option, but it is the only option for him at this point. So we get a lot of questions on Pobly about what do I do with my cat with a broken whatever. As long as they're functional, meaning they can eat, drink, ambulate, urinate, and defecate, typically we will recommend cage rest. It really has to be for 8 to 10 weeks, and they really have to stay in that crate. He has a fentanyl patch on, so we just put a pain patch on him. That will last for a couple of days for him, and that will keep him comfortable. But in general, these guys do heal pretty well if we can just keep them quiet and still. If you've got a question or you've got a cat with a problem, please visit me at Pobly.com. And if you've got a cat with a fracture, please consider cage rest if you cannot afford surgery. It really is a good option for most of these guys. He will have to stay inside for the rest of his life. I'm a little worried about his ability to run away. And for females especially, they have to be spayed if they've got a pelvic fracture, because they will not be able to pass babies through that birth canal. So it's really important if you've got an intact cat to spay or neuter them and keep them on cage rest. That's it. Thanks.